Well, today during the Lindsay Clancy murder trial, we got an alarming look inside the world of psychiatric medicine. The doctor who treated the mother of three who strangled her children to death faced cross-examination, and some of her treatment methods raised questions about possible negligence. Dr. Jennifer Tufts, who had been treating Clancy since 2022, was unaware that Clancy had called a suicide hotline not once, but twice. Listen.
Did you ask her anything about suicide hotlines?
I don't think I asked her about suicide hotlines.
Would it surprise you to know that she called suicide hotline in that time frame, not once, but twice, and was turned away? You guys were in the front line of this, aren't you?
Over the next several visits, Clancy was prescribed a slew of medications for depression, anxiety, and sleep. And while postpartum depression is far more common than postpartum psychosis, we may be overlooking how much help new mothers need, or, we're telling women they can do it all and have it all, but the reality is everyone needs help sometimes. But that being said, are women being overprescribed drugs instead of other ways to manage stress or depression? Is it typical for most women to suffer in silence, as if postpartum depression is no big deal? Joining me now is forensic psychiatrist Dr. Carole Lieberman. So, Dr. Lieberman, Dr. Tufts admitted to not having a full medical history. So what were the most notable warning signs that Clancy's psychiatrist missed while treating her?
Dr. Tufts just came out of a psychiatry residency, and everything she did with Ms. Clancy was a disaster. First of all, this idea of, this is a general problem with psychiatrists. Psychiatrists have become pill pushers. Instead of doing therapy, they just hand out prescriptions. And it's not just trial and error. There are ways that you know which things are most likely to be helpful. And you don't keep throwing just more and more pills at people. That is what happens. Patients come back to the psychiatrist and they're still not getting any therapy. And so they get another prescription. Now, Dr. Tufts said that her appointments, these telepsychiatry appointments, are like 25 to 30 minutes, of which 17 minutes are therapy. Now, what she described as therapy is listening to the patient and giving her hope. That is not therapy. Therapy is getting to the root of her problems, asking her about her marriage, asking her about how she feels about each of her children, and getting down to all of her feelings, not just giving her hope. That really worked well, didn't it?
So, Dr. Lieberman, Dr. Tufts is being sued by Clancy and her ex-husband for over-medication, failing to properly diagnose her after the birth of her third child. Do you think that they have a case just based on what you've heard throughout this trial process?
Absolutely. With Dr. Tufts, and by the way, just to be clear, I was not saying never to use medication, but you need to do it much more carefully and slowly. And with some idea of why you would pick one over the other. I think there was also the testimony of Dr. Goodhart, and she was no stellar psychiatrist either. She certainly didn't do enough when she was in the hospital. She shouldn't have let Lindsay leave when she was in that state. But what was really striking? The defense attorney asked her about what resources did you give her. She said that the resources she gave her was telling her to go to Psychology Today to look for a psychiatrist and to call her insurance company to get a psychiatrist who was on the insurance. That is not the standard of care. You don't send a patient who is still so sick and tell them to look in Psychology Today. Yeah. It's absurd.
Yeah, it seems like there's a lack of care across a lot of different fields in the medical industry, unfortunately. But Dr. Carole Lieberman, great to see you. Thanks for joining me with your expertise tonight.